I am really looking forward to discussing healthcare IT with Becky Fox, the Chief Clinical Informatics Officer at Intermountain Health. Welcome to HealthIMPACT Live Virtual, a monthly meeting where we meet with leaders and ask questions about running a successful team and advancing healthcare, making impact. So, Becky, welcome. Do you want to introduce yourself to the audience?
Sure. I'm Becky Fox. I'm a nurse by background, and I'm the Chief Clinical Information Officer at Intermountain Health, where we're helping people to live their healthiest lives possible.
Amazing. I think I like that mission, like to live your healthiest lives possible. Let's go back to what that means within the framework of clinical informatics.
Yeah, so I joined the organization about 10 months ago, and one of the things that really jumped out at me when I met any of the caregivers that I interacted with, whether it was a frontline caregiver, a bedside clinician, or provider, pharmacist, anyone in the organization, one of the things that was really drew me to the organization was that everyone really lives, breathes, and believes the mission. Everyone's very focused on it. And that also can be found in our informatics team. So every time that we get together, whether we're trying to solve a problem or find a better way to do things, everyone's really driven by that mission to really focus on how do we bring improvement to the caregiver experience, to the patient and family experience, and how to make an impact in the communities that we serve.
Yes, that mission focus matters. I would also like to know, you've consistently led award-winning teams and award-winning projects, including just this last month, you won the clinical leader of Utah HIMSS. So
exciting.
How do you do that? Is there like a method? Like, are you like a walking trophy? Tell us.
I've been really lucky that the teams that I've worked with, and of course, any award that you receive is wonderful recognition, but it really kind of reflects the work that there's many people behind the scenes, teams that put things in action. And so I was really proud to receive the award only because behind me and with me are a lot of other caregivers that make things really happen. And so our informatics team, as I mentioned, we're really focused on that mission. So anytime that we are working through a project, we're trying to say, what is the best decision? Does whatever we decide today, does it make us better than where we were yesterday? A lot of times we put in technology in place, and sometimes it doesn't always go as perfectly as planned. We're all humans involved. We all, come to a project and really put our best foot forward, but sometimes it's not smooth. It's not easy to adopt. It doesn't work exactly in the workflow. And a lot of times we have to go back to the drawing board. We have to really listen to our clinicians. And that's the unique role of being a clinical informaticist, is that you have to have one foot in the clinical world, one foot in the technology world, and you really are there to smooth the edges, to make things easier for everyone.
Thank you. Tell me a little bit about how to build one of those teams. We've spoken in the past about like, how do you build a successful team that's able to kind of, smooth those edges?
To me, the first thing to do is, when I joined Intermountain or any other informatics team that I've worked with in the past, the first thing you have to do is really kind of understand where your team is. So the first thing out of the gate is really getting to know your teammates, hearing and feeling what they're really proud of, what they've been experiencing, what their history is of doing things, and really do an assessment of the team to understand what their knowledge is, what their experience is, even what their diversity in their background might be. So what I've found to be really effective is diversity in thought and in experience. And then when you have different diverse contributors around the table trying to solve a problem, you really can get to unique solutions. So for example, that diversity might mean, you had a teammate that worked in consulting. You might have had a teammate that worked in education and learning services and support aspects. You might have had a teammate that worked truly in build, design aspects or app development. And when you bring all of those folks together on a clinical informatics team, that's how I found is that you really can move things forward in a creative and innovative way. So to me, building a culture of an informatics team, you really need to have those diverse experiences, those diverse thoughts around the table, because technology is evolving really, really rapidly, especially now that we've come out of the pandemic. Everyone is still trying to play catch up and take on real big projects and do them in a quicker way. And so the way you have to be able to do that is you have to put everybody, have an assessment of your team, make sure you set a mission and a vision for your team specifically around informatics, and then make sure you have diversity to contribute to the mission and to the projects at hand.
Yes, you need unique perspectives. So tell me, when you came to Intermountain, what was something unique at Intermountain that you found on your clinical informatics team?
Yeah, I've had a great IT career, been able to work with healthcare organizations from around the world. And one of the things that really resonated with me was the investment that Intermountain has made in their informatics team for many decades. They understood the importance of really having people bridge the two worlds of clinical and IT. And they've also made really strong investments in having those informatics experts even on the floor. So we have a unique program called a clinical shared, a shared clinical leader, and it's a group of about 150, 200 clinicians that actually carve out between 4 and 8 hours a month to really help with the adoption of IT. So even though we have a clinical informatics team, we also have these shared clinical leaders that devote their time out of bedside care, but they can give the perspective of the unit. So they work directly with frontline staff. They explain the new technology that's coming. They make sure that we have good adoption. And most importantly, they're there to help us get feedback from the frontline caregivers, bring it back to our informatics and our IT folks. And then again, we can go back and continue to evolve and optimize the technology that we put in place. So that to me is the secret sauce. We have these shared clinical leaders that really, embrace that role, really are devoted to that role, and really make a difference at our organization.
Yeah, creating with clinicians on the front lines is critical, and also making it
Absolutely.
part of their actual job, not just something you throw on top. Let's talk about a few of the things that are coming up, because you're about to roll out Epic. We've all heard the news. I
Yes.
think people are wondering, what does that look like? Is that just everyone's dream?
It is definitely going to be a big project, but it's one that I'm confident that we will do successfully. Again, back to that mission always centers us. So even, when we're going to roll out a new EMR or we're going to standardize to one EMR, that's a lot of work ahead of us. And sometimes people might say, well, that's a pretty big giant mountain to be climbing in a really short time frame. But what I would say is what we're going to do is leverage all of our experience from the past, really embrace our culture of driving towards a mission, and that is to bring things to our caregivers so that they can be the best when they're taking care of patients.
Yes. So tell me, while you're doing these massive projects, how do you stay ahead of innovation? How do you ensure that you're still, current and relevant and not, going to be 2 years behind?
Yeah, I like to call it just being right on the cusp. So, for example, as an informatics team, what my team and I've discussed is you always have to be evolving. So, for example, one of the unique things that Intermountain has is we have a safety informatics group. So we're focused specifically on safety. If a safety event occurs, whether it's with a product, whether it's with a workflow, whether it's with a system that we might have in place, we immediately have a team that's in informatics that can focus on finding out what the technology challenges might be. And again, smoothing edges and bringing resolution very quickly and rapidly to frontline caregivers. So that's, again, a unique perspective that we have. And so we have to be really mindful of the fact that the organization is going to always continue to evolve, and we have to be right on the cutting edge of that. I'm probably dating myself, decades ago, it was great to have a CNIO, and then everyone caught on and said, hey, let's have a CNIO. And so now the perspective is we need to really look at the entire continuum that occurs inside and outside of a hospital. We also need to look at all of the things that happen to the caregivers. So, for example, I always say, there's almost a patient can't come into your organization and not touch technology. I mean, even to park in the parking deck, they have to get a ticket. It comes out of an electronic machine. There's technology involved. And so there's always some aspect of technology that's touching our patients, that's touching our caregivers. And so our team has to be on that cutting edge. So as people talk about AI, we won't shift our entire team to go focus on AI, but we will have a few folks that will become embedded in projects or pilots. We will have a few teammates that we will send to conferences and really become educated and well-versed in AI. And then as those technologies continue to develop and be adopted into workflows, then our team will ramp up on that. So that's, again, the great thing about having a diverse team. You don't have to have your entire team become an AI expert. You just need a few folks in there. And then as that AI continues to develop and evolve, then of course you can share that love and fun with everyone else.
Yes, that's a great perspective. I was going to ask you like how you decide like which technology to roll out, when to pivot people, when to hold back. Is that like a planned thing, or is it just that you assign people to different teams?
Yeah, it kind of occurs naturally. So for example, even with our Epic project, we'll take a portion of our team. They will be focused, heads down 100% of the time on making sure that we really have the right workflows embedded in our Epic rollout. There will be a part of our team that will be heads down focused on the education, the learning, and engagement of our frontline caregivers to make sure everyone adopts it and really understands how to use Epic to its full potential. And then we will have some members of our team that will be keeping the lights on. But as we get closer to go lives, as we get closer to stabilization, we will gently bring other folks over to help and transition over to the team. And the same thing would hold true to any AI, ChatGPT, ambient listening, ambient intelligence, whatever new technology will be coming down the pike. That's what we will do. We generally put a few folks on it at first and then end up spreading it to the rest of the team in a kind of natural transition.
That makes a lot of sense, just to be able to have that freedom to learn. So tell me, what are you looking forward to in the coming months in healthcare, in your clinical informatics team?
One of the things I'm really looking forward to is, we have a variety of different EMRs. And so right now it can feel pretty overwhelming to say, oh, how are we going to consolidate everything to one system? But what I really like in that is that it's a great opportunity for everybody to learn, to listen, to learn, and to collaborate together. And what I've found, and I'm sure like many other organizations throughout the world is, the pandemic, if it taught us nothing, it's don't sweat the small stuff. We just have to work together. It's okay if things aren't perfect because we're all driven to make it better. And so that's what I'm really looking forward to. So even though there's a big project at hand and there will be other projects that have to happen in parallel to that, what I'm really excited for is it's an opportunity for our teams to really work together. And when I say our teams, our informaticists to work with our operators, our facility leaders, our frontline caregivers, and really create something that's going to be long lasting and make a difference to everyone.
Thank you. I want to make sure too, as we close out, I want to make sure you have an opportunity to share anything you feel like we missed or you feel like people need to know.
Well, one of the things that I would share with anyone who's out there really evolving their clinical informatics team is we've done a pretty good job. Like I said, we've evolved from just having one clinician in the IT department to really now having, pretty robust and diverse teams that can come together and put new solutions in place and optimize projects and technology. But what we really need to do, the call to action, is we need to share these lessons outside the walls of our own organization. So that's what I'm really kind of stressing to my team is this whole networking needs to occur across the United States and around the world. So if someone at Mayo has, implemented a program and they've used it for thousands of patients or, hundreds of caregivers, let's take those lessons learned and build upon that. If someone at another organization, tries something and it fails terribly, let's all share in that knowledge so that we can move and advance the ball in a different way. And that's one of the things that I'm really excited about is, we all have these great, whether it's the social media platforms or coming to conferences and getting together in small groups, it's really important to share all the great successes that we've had, the failures, the challenges, how we've overcome them. And more importantly, just to feel like you're not alone. So that's what I would just say. Collaboration is key to making sure that we're all advancing healthcare. And I'm really looking forward to in the next year or so that, we're going to be doing that and hopefully a lot more through HealthIMPACT as well as other organizations.
Well, thank you. I'm grateful. I think that's so important to share what we know and help everyone move together faster and towards healthier lives for everyone. Again, I want to thank you for your time and invite everyone to stay and listen to our live roundtable at 4 p.m. Becky Fox, the Chief Clinical Informatics Officer at Intermountain Health. It's always a pleasure to catch up. And
Good to see you.
I'm glad I get to hear about your work to build great teams.
Awesome. Thanks so much for your time.
Limited staffing, manual processes, complex compliance audits, growing cybersecurity risks. Today's digital healthcare landscape demands IT modernization that reduces friction between clinicians and IT teams while keeping patient data secure. That's why top hospitals and healthcare organizations are transforming their identity security programs with SailPoint. SailPoint's identity security solutions empower healthcare organizations to quickly and securely enable clinical workforces with the right access at the right time. Through the power of machine learning, clinicians can spend less time on administrative tasks and more time on patient care. Only with SailPoint's AI-driven identity security can healthcare IT and security teams save time and resources while maintaining a strong security posture. Intelligent identity security simplifies compliance reporting, automates manual processes, and accelerates access decisions. SailPoint expedites identity security with instant frictionless access to the appropriate applications, systems, and data your clinicians need from day one, reducing onboarding time from days to mere minutes. From community hospitals to complex healthcare systems, SailPoint helps organizations make rapid identity decisions, protect against over-provisioning, and safeguard sensitive clinical data. No matter the maturity level of your organization's identity security program, SailPoint is ready to help. Discover the core of identity security with SailPoint.